The case was confirmed on the 27th of February 2020.
As at February 27, 2020, when an Italian was diagnosed with Nigeria's first case of COVID-19, there were already 13 Lassa fever-related deaths from 102 confirmed cases across 18 states. This proved to be the worst ever Lassa fever outbreak, with an approximate 45% increase in the death toll over the previous year, and it has not stopped. But Lassa fever is taking a back seat to the pandemic that COVID-19 has become, which claimed almost 1,300 lives in the country by the end of 2020, and 20 doctors in 1 week in Nigeria. The re-emergence of yellow fever took the health sector by surprise, the weakness of its foundation exposed by the pandemic.
Access to healthcare was affected drastically because people became afraid of going to hospitals because they were afraid of, let me not go to the hospital and then I'll be tagged as having COVID, or I'll go and contract COVID from the hospitals. So you had surgeries postponed, you had things, people who had oncology cases, cancer cases, had to be okay, you come back another time. Because when you have a whole unit that is taking care of patients, maybe when one doctor or one nurse or a health worker is affected, having to close down that unit, so the patients that have been coming to that unit are affected.
No one knows when or if COVID-19 will end, but it will be remembered as the cause of thousands of lost jobs, broken economies, a new way of living, and the fastest ever race for vaccines. It was indeed a bright spot in Nigeria's health sector to receive the polio-free certification from the World Health Organization, the last African country to achieve this feat after going 3 years without recording a case of the wild polio virus. The budget allocation for health in 2020 came to about 427 billion naira, a mere 4.14% of the total budget and far short of the 15% ideal. Effort for the COVID-19 pandemic came mostly from special funds and the private sector. Experts say outbreaks will happen from time to time, so preparedness should be the watchword.
All the factors that make for emerging infections are working together. Large population that's still increasing, poor housing, poor environmental sanitation, we have more avenues for mosquitoes to breed, rodents to breed. So whether it's Lassa fever, whether it's yellow fever, whether it is COVID as we have it now.
An emergency plan should be available at every level, state government, local government level, district level.
Resident doctors, considered a major workforce of public hospitals, embarked on a strike to protest lack of personal protective equipment, non-payment of COVID-19 inducement allowances, life insurance and death in service benefits, among other things. Government responded with an increased supply of PPE and more testing facilities across the country, but according to resident doctors, did not meet other demands once they called off the strike. The Minister of Health unveiled the revised Universal Healthcare Fund implementation guidelines leading up to 2022. If adhered to, this plan should improve healthcare indices in the country. Mary Alale Yusuf, Channels Television News.